Arch here on the Health Talk Show. This and every Saturday from 4 p.m. to 5 p.m. UK time on our Coco African Radio UK. Join Arch here on the Health Talk Show this and every Saturday from 4 p.m. to 5 p.m. UK time on our Coco African Radio UK.
Hello everyone, welcome to Akoko Africa UK Radio. I'm very sorry for starting this program very late. We have a little bit of problem, but we are here now. Today, our topic for the day will be for cancer for children. It's Health Talk with Atswei. On the 15th of February, there was it was observed as Childhood Cancer Awareness, and we've chosen this topic to discuss it with you guys, just to create awareness about childhood cancers. Today we have here Miss Ewurama Siaw to discuss this topic with us. You are welcome, Ama.
Thank you so much, Atswei.
Okay. So, whenever people talk about cancer, they get scared. They think cancer is a death sentence. But we know if we create awareness and is seen or diagnosed on time, it doesn't necessarily mean death sentence.
Exactly.
And most of the time, we talk about adults, but no one thinks about the children.
Exactly.
So today, we are here to discuss about children having cancer, going through cancer, the survivors and their families, what they go through. Okay, so to start, what is cancer and what are the causes?
Okay. So, thank you so much, Atswei. So, cancer basically starts when cells in the body, they grow out of control. So, human beings, our body is made up, the building block of our body is called cells. So, cells make up our body, and these cells keep growing and regenerating. And they're supposed to follow a certain pattern, but sometimes we have errors in them, and when these errors happen, they grow out of control and then they become cancerous. So every cells in nearly every part of the body can become cancerous, and this cancer can spread from where it starts to other part of the body as well.
Okay. So is there a difference between cancers that affect children and adults, or is it the same type of cancer that they both?
Yeah, actually, yeah. So children have different types of cancers that affect them generally. Some children do get adult cancers, but there is a difference between the typical type of cancers that children get compared to what adults get as well. So yeah, you are right. Children have different cancers compared to what adults get.
Okay, so in case of like treatments for children, is there success or?
So the success rates for treating cancers in children are actually much better than adults. I mean, you'll be amazed at these little things. You think they are not that strong and all that, but I can tell you, I mean, some of them are so strong, the power they have. And most of their treatment are very intense. So, for instance, the chemo or whatever they go through, it's so intense because their cancers can be quite fast growing as well. So they need intense treatment to get it under control. And these children actually come out like with guns blazing, and their survival rate is actually much higher. But also we have to take into consideration that children's bodies haven't gone through all these lifestyle changes that we go through as adults. So for instance, adults, we unhealthy diet, smoking, drinking, all this affect us, and then we have comorbidities that affect us as well, and children don't have that. So because they don't have that, it's quite easy for them to fight cancer than adults.
Okay. So what are the types of cancers that develop in children?
So the most common type of cancer that children get is leukemia, And then leukemia is cancers of the bone marrow and the blood. And then these cancers, they are common in children, and when they get it, they have a lot of pain, like joint pain, fatigue, weaknesses. Sometimes they have bruising, so your child is not falling over or anything, but you can see bruising on them. Sometimes they bleed as well. They have fever, unexplained weight loss, and then they might have other symptoms as well that I can't go into all of that today. But we normally have acute lymphocytic leukemia, and then you can have the acute myeloid leukemia as well. And they grow very quickly. So because they grow very quickly, they are typically dealt with chemotherapy as soon as they found out. We also have brain and spinal cord tumors, which is the second most common. And then this brain tumors are found in the brain, and most of them are found in the midbrain, so the lower midbrain, and then the cerebellum. And then also you have some in the spinal cord, but most of them are found in the brain, or every part of the brain. And when children have brain cancers, some of them, they have headaches. So if your child is complaining of headaches all the time, I mean, it's something for you. Some of them have nausea, vomiting, they have double or blurred vision, and then some of them can become quite aggressive, because the cancer can actually change their personality. So when you see anything like that in your child, it's best for you to let them have a look. Some of them also have spinal cord tumors, but they are less common than brain tumors as well. And then another type of typical cancer for children is called neuroblastoma. So this starts in early forms of nerve cells in developing embryos, and they develop in infants and young children. So it is very rare in children that are older than 10 years old.
Okay.
And then the tumor can start anywhere, but it usually starts in the abdomen. And then you see it as a swelling. So if you notice any swelling in the abdomen of your child, really have a look. And then sometimes, I mean, as mothers, you have to feel your child's belly. So you're not hurting them. When you have a baby, you feel their belly. It's supposed to be soft all around and squishy. But if you find any mass, anything that is hard, anything that is out of place, I mean, it's not supposed to be there. So it's best for you to get it checked out. We have Wilms tumor that commonly starts in one kidney, but rarely you can find them in both kidneys as well. And then they are found in children between 3 to 4 years old, and it's not very common in older children. And then that can also show up as a swelling in the abdomen, because obviously that's where your kidney is. And the child can have fever, pain, nausea. I mean, the typical symptoms of children having cancer. They might have a poor appetite as well. So it's something to look out for if you find any swelling, any lumps in your child's abdomen area. The next cancer I want to talk about is lymphomas. So they start in the immune system cells, and they're called lymphocytes. And then they often start in the lymph nodes and other lymph tissues such as the tonsils. They can also affect bone marrow.
Okay.
Yeah. And symptoms of that can include weight loss, fever, sweat, tiredness, lumps, swollen lymph nodes, so you have to feel under the skin, the neck, armpit, where your lymph nodes are, or your groin area. There are two main types of lymphoma. So we have the Hodgkin lymphoma, and which is also called Hodgkin disease, and then we have the non-Hodgkin lymphoma. So Hodgkin lymphomas can also occur in adults. So the Hodgkin is most common in adults in their early adulthood. So people usually in their 20s, and then it can happen later in your adulthood, so late, 55.
Okay.
It's very rare in younger children who are less than 5 years of age, and even though it's all Hodgkin lymphoma, the Hodgkin lymphoma you found in children is different. It's not very similar to what you find in adults. And then the non-Hodgkin lymphoma is likely to occur in younger teenage children, but it's still rare in children who are younger than 3 years old. And the most common type of non-Hodgkin lymphoma in children are different than those in adults. So whereas the Hodgkin lymphoma is very similar, non-Hodgkin is very different. Okay. So they have different treatment for them. So these cancers, they can grow quickly, and then they require intense treatment. But they tend to respond better to treatment as well, which is very, very good. Another treatment that cancer that we mostly come across in children is called rhabdomyosarcoma. And this starts in the cells that normally develop into skeletal muscles. So these muscles help us to control movement in certain parts of our body. And they can start nearly in any place in the body, including the head, the neck, the groin, the abdomen, the pelvis, in the arm or the leg. And they can cause pain, swelling, so you find a lump, or you find both, pain and swelling here. And then the most common type of soft tissue, they are the most common type of soft tissue sarcoma in children, so rhabdomyosarcoma. And then another one that we come across often is retinoblastoma, which is the cancer of the eye. And it often occurs in children around the age of 2, and is seldom found in children who are older than 6 years old. So it can be found by a parent or a doctor, and then normally when you shine a light in the eye, your pupil come out as red because you have the blood vessels, but because if they have cancer, they come out as white or pale, pink, and they should tell you that there's something wrong with the eye, so you need to let them have a look at it. The last one I want to talk about is bone cancers. So they start in the bones as the primary bone cancers, and then they occur mostly in older children and teens, but they can develop at any age. So the two main types is osteosarcoma, which is most common in teens, and it usually develops in areas where the bone grows quickly, so near the ends of the leg or the arm bone, because that's where it stretches for you to grow. And it can form painful, you have pain in your joints, and it gets worse at night, and especially when they're also doing activity as well. It can cause swelling around the area. And then the other form of bone cancer is the Ewing sarcoma, which is the less common type of bone cancer, and it's mostly found in young teens. So the most common places for Ewing sarcoma is at the start of the pelvic bone, so where your pelvic bones are, your chest wall, your collarbone, your shoulder blades, your leg bones. It can happen in the middle of your arm or your leg bones, and symptoms of this can include pain and swelling as well.
Okay. Looks like there are lots of different types of childhood cancers.
I mean, this is quite a few of what I've spoken about. So, I mean, they can still have other forms of cancers, but these are the most common ones that we see.
Okay. Thank you. So, we are live on the radio, on Facebook, and on YouTube. You can send your questions and we'll ask Ewurama to, we sure she'll give you the answers you want. Okay, we're moving on. The next thing is, what are the risk factors and causes of childhood cancers?
Okay, so when you talk about risk factors, it's anything that increases your chances of getting a disease. So, with regards to children, we won't talk about lifestyle, because obviously, so lifestyle affects adult cancer. So like I said before, lifestyles such as not eating right diet, smoking, being overweight, not having enough exercise, drinking alcohol, they play a major role in us getting cancers.
But some of this can be controlled by the parents, isn't it?
Yeah, so it's not for children. So I'm saying that lifestyle is about adults. And even with that, it needs to build up over a certain number of years. I mean, children haven't got that many years, so it's widely not believed that lifestyle can cause cancers in children.
Okay.
Yeah. Environmental factors, radiation exposure can cause cancer. So for instance, if a child has already had cancer and they've been treated with radiation therapy, so because the radiation therapy targets the unhealthy cells, it can also affect healthy cells, and that can develop into cancer later on. So those are the environmental factors. But with regards to lifestyle, children don't have cancers based on their lifestyle. Yeah. It's believed that certain genes are passed on, so DNA are passed on from parents to their children. So it makes the children become predisposed to getting certain types of cancers.
Okay.
And when it is tested in your parents, these children normally have regular tests. Sometimes, even if they think it's going to affect a certain organ, that organ gets removed to decrease the child's chance of getting cancer.
Okay.
But these are also really very rare. We think cancer in children are normally caused by DNA, our DNA in our cells changing. So when your cells change, they divide, they multiply, they regenerate. They are supposed, when the cell splits into two, and then it splits again, it's supposed to copy the DNA of the parent cell.
Okay.
Sometimes those children are growing, cells are growing, a lot of stuff is happening. It doesn't copy the exact DNA of the parent cell. And when it doesn't happen, when these errors happen, the cell can begin to grow out of control and it can cause cancer.
Wow.
So children, I mean, like you said, parents obviously control your children, make sure they eat a healthy diet, make sure that they take good care of themselves, and don't introduce them to smoking. I mean, don't smoke. I mean, we have a smoking ban in the UK where parents are not allowed to smoke in the house because smoke inhalation is generally not good for children. So as a parent, you need to take good care of your child. Make sure you provide them with a well-balanced diet and then teach them good lifestyle. However, when a parent, it's like when a mom is pregnant and is smoking, stuff like that, there's still tests going on to see if the parent smoking at that time or drinking alcohol, does it affect the child? Does it predispose them into having cancer later on? But a lot of tests is still going on and it hasn't been confirmed yet. So just make sure you introduce your child to good lifestyle. But most of the time it's because our cells are dividing, they don't follow the parent DNA, and they go out of control. And then also, if your child should have cancer, I know some parents will go, what could I have done to prevent that? I mean, there's nothing. Don't feel bad that your child has cancer. There's nothing you or your child could have done to prevent that.
Yeah, I was going to ask, can those childhood cancers be prevented? Can it be prevented at all?
So like I said, make sure you feed your child a well-balanced diet, take good care of your children. But if your child develops cancer, it is really important that it's extremely unlikely that there's anything that you or your child could have done to prevent it. However, that doesn't mean that you should just introduce your child to everything. They are kids. They are very precious to us. And we want the best for them. We want to take good care of them. So just make sure you provide the best possible care you can give to your child. However, if they should develop cancer, it is extremely unlikely that there's anything you could have done to prevent that.
And I believe that there are some children who are already born. By the time they were born, they already have cancer.
Yeah.
They don't, yeah.
Yeah, so that's, as I was saying, that these cells, they divide and then they copy the parent cell's DNA. So as the embryo, fetus is developing in the tummy, these cell changes are happening. It's building, it's splitting, it's building. So when that error occurs whilst the child is in the tummy, we've had instances when children are born with tumors, with neuroblastomas, and there's nothing you could have done. It's just that random events happen and it caused the cancer. So we just have to take it on board and then see how best we can move forward in terms of getting the right treatment for the child.
Okay. So how is this done? Screening for cancer in children, how is that screening done?
So because children rarely get cancers, there is no screening program for children. However, if you feel that there's something wrong and you go and see your doctor, they will ask about your medical history. They will do a few tests. They will do blood tests. If they can see a swelling or a lump, physical one, they can take it all or take a bit of it and then take it for a biopsy just to look under the microscope, check the cells to see if they are cancerous or not. You can also have various different type of imaging tests. That is why I come in. So you can have an ultrasound test where we use sound waves, and then it gives us a picture of your internal body, and that tells us if there's anything going wrong inside. You can have x-rays, which is very good for bones. We can do that as well. Or you can have a CT scan. We use a number of x-rays to form pictures, extra slice of pictures inside your body. And then we have MRI. We use magnets and radio frequencies to also form pictures of your inside. So it helps the doctor to see what is going on your inside, and it helps them to diagnose the cancer.
Wow. This is interesting. I'm learning a lot today. So, what are the possible signs and symptoms to look out for in your child?
Okay.
Yeah.
So, many cancers in children are actually found early, believe it or not. Obviously by the parent. So, you have to examine your child, and if you find anything, let them know. Or if you take them for your regular checkup at the GP, the doctor can find that out as well, okay? But sometimes cancers in children are very hard to recognize because some of the symptoms look like a natural thing. I mean, if they are running around, jumping around, they get bruising and stuff like that. So it looks natural, and you might not think it's cancer, but you just have to, as a parent, just keep an eye and then see if you see anything that is not common.
If you can take a bit into your mic, you're not hearing you properly.
I'm so sorry. I am so sorry. Is it better now?
It's better.
Okay. So, some of the symptoms, I mean, this is not all of them. I'm just going to talk about a few of the symptoms, okay? So, when you find an unusual lump an unusual lump or swelling in any area of your child. So you find swelling on their skin, you feel it, please let them have a look. Swelling or lump in the abdomen, like I said, it's not supposed to be hard, it's squishy, so just feel it. If you find anything like that, you need to take them to the hospital. Okay? If you find any unexplained paleness or loss of energy, children are full of energy, so if you see that they don't have any energy and it goes on for a while, please have them checked out. So if you see that they bruise easily or they are bleeding, that's not normal. You need to have them have a look. And then if they have ongoing pain, if they are limping, they complain of fever, illnesses that doesn't go away for a long time, and then they have frequent headaches, like vomiting, they have sudden eye or vision changes, and then also if you find that, your child has become very aggressive, it's not, because some of the brain tumors can actually change the child's personality based on where it is in the brain. Okay. So if they become aggressive and they're not like that, you need to take them for them to have a look. Okay? And these symptoms are not like exhaustive of everything that's happened, happened. There are some that obviously I can't cover everything here, but these are just a few that I can say. If you find, for instance, they have a sudden unexplained weight loss. You're feeding them the right amount of food, they have everything, but they're still losing weight and it's not explained, you need to let them have a look at.
Okay. So what is the best time to decide now I have to go and see a doctor?
I guess it depends on the parent. So for me personally, I have a 14-year-old daughter who was born with a mole. They have 2 moles, one on the thigh and one on the leg. So I've been monitoring that mole, and then it got to a point I realized that it was getting bigger. I just went to the GP, and then we went to see a doctor. They had a look, and then they explained to me that it wasn't cancerous, and they gave me the reasons why. And even after that, she's still being looked after, so we have yearly appointment for them to monitor it. So as a parent, if you see that your child is bruising and bleeding, I wouldn't wait. I wouldn't wait. I would go to a knee. If your child's personality changes and they're nice and everything, but they become very horrible, crying, kicking, doing stuff, you might think, oh, they're going through a phase. But if they're not like that and it changes sudden, I'll have a look as well. If you see that you're feeding them, but they're still losing weight and it's not explained, we don't just lose weight like that.
No.
Yeah, so unless you're doing something for them to lose weight, but if you're not and they're losing weight, speak to your GP. It's just a phone call.
Yes. I was going to say, nothing is too small. If you feel a big concern, just go. And if it's nothing, you have your peace of mind.
Exactly.
Yeah. Okay. So treating children with cancer.
Yeah. So you see your doctor, they've done the screening, they've done the test, they have found a cancer. Your doctor will check medical history of the child, and then most of the treatment, the common treatment they will have is sometimes it's surgery, just to take the cancer away, the tumor away. Sometimes it's a combination of surgery, chemotherapy, and radiotherapy. So surgery is when you take the cancer away and then you monitor just to make sure that all the cancerous cells have been taken and there's nothing remaining. In terms of radiation therapy, or we call it radiotherapy here, is when they use radiation to kill the cells, that the cancerous cells in the body. So this is why I said sometimes, so for instance, if a child has cancer around in the lungs and is being treated by radiotherapy, even though the radiation therapy is to actually target that, it might also affect the healthy cells. And because of that, it needs monitoring because we don't know what that will cause. So radiation therapy is often limited when treating children, cancer in children, because of the side effect. And then one that we have is chemotherapy, where the child is given a mixture of drugs. Some are done intravenously, some of them are taken, and it goes in your blood and it's supposed to kill the cancer cells and then to make your child better.
So, would you say you get a lot of success in like treating childhood cancers? Or?
Of course. So childhood cancers tend to respond better to certain treatments, such as chemo. And then this might be because maybe the cancers tend to grow quickly, and chemo works better against fast-growing cancers. So children's bodies are also very healthy. They don't have bad lifestyle features like us. That, like I said, unhealthy diet, poor diet, drinking, smoking. So they are able to fight and recover than we are. And then also, doctors use very intense treatment for these cancers for children. So the more intense the treatment, the better of the cancer going away. However, this can lead to more short and long-term side effects. So unlike chemo, radiation therapy can often cause more serious side effects in children, especially very young children and adults. So like I said, its use is sometimes limited, okay? But the doctors will balance the treatment based on the cancer that your child has for you as well.
Wow. Okay. I've seen all your questions here. I'll come back to it in a minute. I just have to finish with Ewurama. So after treatment of cancer in childhood, what do we need to do? Is there a follow-up or?
In children, actually, that is what is most important in terms of childhood cancer. So I know as people, as parents, as family, you hear cancer and everybody's panicking, and all we're thinking about is how are we going to get rid of this cancer? We don't want the C word, we want to take it away. And I mean, we have the support from the specialist hospitals. Children are normally treated in specialist children hospitals that we know how best to treat children. So you get a support from there. You have a whole team. You get support from your family. You get support from your friends, from the community. And then the children, they beat it. I mean, they go to stuff. They have this thing where they ring the bell. I'm cancer-free. With regards to children, because they've still got so many years ahead of them and because they are still growing, the problem that we face is the side effects from the treatment. So we treat them, the cancer goes away, but is the chemo going to have any more side effects later down the line? Is radiation going to have any side effects? Even the surgery that they've had, if they have a brain tumor and it's taken out, as the brain is growing, is it going to affect how the child behaves, how their life later down? So follow-up appointments are very, very important in terms of childhood cancer. I mean, we don't joke with it. So after treatment, your doctors will sit down, team will sit down with you, the follow-up appointment, they tend to be very frequent to begin with. So maybe every month, every 3 months, and then as you go, the child keeps growing. It might go to every 6 months or every year. But it's important that as a parent, just because your child is cancer-free, please go for your follow-up appointment. Because the cancer can come back, another cancer can develop. So you need to go for them to monitor the child, just to make sure that the child is okay. Okay? Because the side effects of this treatment, like I said, if it's a brain tumor, are they going to get learning problems, learning difficulties later on? Because they've been treated, are they going to be at increased risk of cancers later on in life? Okay. Some children, when they are treated, they get slowed or delayed growth and development in the bones and in their overall bodies. And then some can have heart or lung problems due to certain chemotherapy drugs or radiation treatment to the chest area.
Okay. Wow. So in kind of support, is there like a support for like parents who have children with cancer or the survivors? Do they have like a group or something that you go and to help each other? Yeah,
so they have a lot of support. I know that Cancer Research UK, they have one of the how do you call it? So they have a branch in there that deals with just children cancer, teenage cancers, and I know they have a lot of information on their website that on how to join. So it's not just adult cancers that they have support system, but I know that the support system is all around Macmillan Cancer. They have a support system as well for childhood cancers as well. So, and even in the communities, in the area you live, if you're not sure, you can go to your council, ask them about, as a parent, support you get at home when your child has cancers, because sometimes the children have to use wheelchairs, they can't walk during treatment or even after treatment, and they need to be able to get help. So you can go to your local authority to get help. You can go to Cancer Research UK, Macmillan Cancer, and you can get help from there. And then also we have lots of information when you go into treatment at the hospital. So we also have support systems in the hospitals that parents come to, and it's amazing.
Wow. So would you say success rate is good in children?
It is. I mean, children come in and you see them, they are very poorly, and it breaks your heart. Your heart just goes out to them. And then you see the biggest tumor ever after your scan, and then you think, oh my God, is this child going to survive this? I mean, sometimes we cry and all that, but they do. They do. I mean, it's amazing. If you follow what you've been told to do, follow the right treatment, get the right treatment, right support, they go through the treatment, and then you see them bundling down. They're so cheerful. And then because we treat them over years, you get to be friends with them. They get to know your name. They get to ask for you, come in, they see you. And it's such a joy.
Yeah, it gives you so much joy to see
I
them.
know. So then it makes you realize that whatever you're doing is actually really good. And I really love my job. I love what I do. I love working with children, because I see the poorest child ever, so poorly in terms of sickness, and then they go through the treatment, and the treatment is intense, I kid you not. Some of them, the hair fall out. Can you imagine a girl with, our hair is our pride. Hair falling out. But they go through it, we encourage them, and then they go to surgery, and then they come out, and it's amazing. It's amazing. I don't know how to describe it. I see them, they get better, and then you're like, oh my God, you are much better. So success rate, I don't deal with adult cancers, but success rates in terms of childhood cancers, I can say it's really amazing. It's really, really high. And I just want to encourage parents out there, please don't be scared when your child has cancer. Like Atswei said, it's not a death sentence. Trust me, they'll get better, okay? We just have to follow what we told, go through treatment, they get better. Unfortunately, just a few don't make it. However, most of them do make it.
Wow. Thank you so much, Alma, for this interesting information. So, with this, all we can say is it's about timing. You don't have to waste time.
Yes.
You see something, you just have to go and check it. I know when I was a kid, they always say I run to the doctor all the time because whatever happens to me, I feel like I'm going to die. So, any little thing, I want the doctor to say it's nothing. Then I can sleep. And I think that saves a lot of lives.
It does, yeah.
It does. So
it does, please.
If you do it on a timely basis, I think we can all together beat cancer.
Yes.
We will be able to do that.
Yes.
All right. So we have a few questions here for you.
Ooh.
We've concluded as much as we think on the topic. So if anyone has any other questions, you can bring it. I've got a few questions here on Facebook from Joyce Osekre. She said, what can we do to encourage a parent with this problem?
Okay, so I think first of all, talk to the parent. So I think people scare parents into thinking that, oh, if your child has got cancer, then you are a bad parent, stuff like that. So talk to the parent, educate them. Sometimes they don't know. They don't know the signs to look out for. So for instance, if when you live in a home with someone and you see change in your child, and they don't see it because, I mean, at the end of the day, we are very busy trying to make life, trying to find food for our children and all that, making ends meet. It's not easy. So we might overlook certain things. So when you see, speak to the parent, tell the parent that, you know what, I've seen this change. I don't know if you've seen it or not, but this needs to be looked at. And even if, maybe if it's in Ghana and the parent doesn't have money to go, even if you can help to take the child just to have a look at it. It might be nothing, but like you said, everything you wanted to go. So just go have a look at it. And if it is, then they can catch it in time, because when you catch it in time, then the treatment will work better. So if you see it, I'll say speak to the parent about it in a very nice way, educate them, and then help them to get help them to go see a doctor.
Okay.
Join Atswei on the Health Talk Show this and every Saturday from 4 p.m. to 5 p.m. UK time on Akoko African Radio UK. Join Atswei on the Health Talk Show this and every Saturday from 4 p.m. to 5 p.m. UK time on Akoko Africa Radio UK.
Hello, you are still listening to Akoko African Radio UK, and we are on Health Talk with Atswei. So we had Ewurama here today to discuss childhood cancers. She's gone through a whole lot. We'll leave some of these things on our page for you to later on go and check. All too soon, we've come to the end of the program. I hope you've learned something today. And I want to ask Ewurama if she's got anything to say to our listeners concerning what we've discussed today.
I just want to say thank you to all the listeners of Akoko Radio UK.
Mm-hmm.
It's been wonderful. I've been on the show. I hope that whatever we discuss is going to help a parent somewhere, because obviously our children are very precious to us.
Mm-hmm.
We love them and we want the best for them. So thank you, Atswei, and thank you, listeners of Akoko Africa Radio.
Thank you. Oh, it looks like I've got some more questions for you. You can run now. Also, these are no questions. Rose Johnson said thank you to Ewurama.
Oh, you're most welcome, Rose.
And Vishkon Nati Kudos says we are proud of you. Thank you very much. And Rose Johnson gave us fire.
Oh, fire.
Thanks to everyone, and hopefully next week we'll come up with another topic very interesting as well. So don't go anywhere, okay? And Ewurama, thank you so much for coming.
You're most welcome, Atswei.
Thank you. Okay, so tomorrow there will be Shepherd's Hour with AC. Please Make time with her. She's always get something good for us. There will be no Kobe show tomorrow. Until I see you again next week. Bye from all of us here.
Bye.
Bye-bye.